It's time once again for our bi-weekly chit-chat with Dr. Jaimie Ronchetto, my veterinarian, Cinema Veterinary Center, who just saw all three of my doggies over the weekend. Studies have shown, by the way, that people who own pets live longer, have less stress, and have fewer heart attacks. Would you say that to be true, Doctor?
I think that's totally true.
And, well, I would say this, though, because somebody had shown a picture, though, because I belong to a beagle group since I have three beagles, that they had come downstairs and their beagle, like, torn up their leather couch. Oh, so that, though, if you survive that sort of thing, then the rest is easy. But speaking of survival, this is, we talk a lot about a lot of different things and a lot of different pet health issues. But this month, May, is Pet Cancer Awareness Month, and this is something that, just like with when humans are afflicted, that it's an emotional situation, but I think there's a lot of confusion about it for pet owners as to the recovery times and what options they have with dogs and cats. So first of all, let's start with dogs. What are the most prolific cancers that dogs might get?
I would say that the cancers that we see the most would be either lymphoma or various tumors on their body that can be different types of cancer types. The thing with skin tumors, it's always a good idea to get any new lumps or bumps checked out. They could be nothing, but we want to check them and make sure that they're nothing. If they're anything that we need to worry about, if they're growing quickly, changing, if they're bothering the pet, getting red and angry, those are the kinds that we would want to remove and actually test at the lab to let you know what to expect. So, it's always kind of a scary thing, and some people don't want to know. I always think that it's better to have as much information as possible so you can know what to expect, as well as how to sort of help your dog's quality of life the best. There's certain ones that once you remove them, that's it. And there's others that might want to come back, so we want to keep checking.
And I've known dogs that have friends of mine who've had dogs that have full recoveries from things like that. And I know, like, as dogs get older, especially my buddy who's almost 15 has had for several years off and on different types of those types of lumps. And fortunately for us so far, they have been benign. But there was one that was a few years back that had grown very large on his hind quarter, on his back leg. And so those are the things that you get really worried about.
Right.
And so that's good that there's at least making sure that we're taking care of those. In a lot of cases, yeah, they are benign, but you never know.
You never know.
What about cats?
Cats are a little trickier. They don't typically get skin growths that you would see like dogs do that would make you want to bring them in to get them checked. And I know cats are trickier just to bring in general. They get stressed. It's hard to get them in the carrier. So oftentimes we don't see kitties until they're really sick. All the more reason to try to bring them in at least annually so that we can be seeing them more often, so we know when there's those changes and we can catch them early. Typically with kitties, they a lot of times with older cats, they will get like intestinal cancers. Intestinal lymphoma is a pretty big one, and that would present more with just potentially weight loss, vomiting, diarrhea, kind of a chronic nature, just not doing the greatest. And that would take more diagnostics than just an exam to really get to the bottom of. Oftentimes we'll need an ultrasound and even potentially take biopsies if we need to.
And I want to be careful because I know that it's breakfast time, but in certain cases, especially kitty cats with hairballs and things like that, we get kind of used to, or sometimes on a hot day, they'll just kind of blah, So right. What we're looking for, especially in those situations, is a big change of more of a more repetitive or more frequent of regurgitation,
Correct.
Excuse me, and also looking for like a different texture or color, right?
Yes,
especially
yes,
okay.
Yes, absolutely.
Sorry if you're having breakfast. I'm trying to sugarcoat this as best as I can. Oh, that just made it worse, didn't it? But let's talk about treatments, because dogs and cats can recover, and there are some treatments that are kind of similar to what humans receive when it comes to cancer treatments, right?
Exactly. So, like I mentioned before, some cancers, if it's a certain tumor type, once you remove it, that's it. You don't have to worry about doing anything else. But there's others that if you get the diagnosis, that we may recommend going to an oncologist. There's different chemotherapies that we can use, and there's radiation therapy that we can use. A lot of people are turned off by chemo because they think of it how we use it with us. It's different with pets because we can't tell them you're going to feel really crummy, but this is why we're doing it. We have to dial it back a little bit for them so that they don't have those or as many side effects as we would see with people. It's all about their quality of life. So we want them to still feel good while going through treatment. And there's many different types of chemo. So some you can even just give orally at home. They don't require a whole big visit, and others do. So I always encourage at least to go for the consult, see what your options are before making your decision.
Right, it's all about the pet's quality of life and, of course, what you feel is best for them. But rather than just going, oh my gosh, you might have, okay, that's it, we're taking the drive, at least making sure. Because, again, I know plenty of pet owners who have had full recoveries for their pets.
Right.
They've lived long, healthy lives, and that's what's important. Take your dog and cat to the vet on a regular basis. Again, all three, you saw all three of them. We had all three in the same waiting room.
Yep.
They were actually good doggies, and especially Daisy. And there's things really like that. Our, looking at, taking the blood tests or getting the blood tests and making sure that their levels are good, especially as they get older. And I have a almost 15-year-old dog that, as you say, is in pretty good shape.
Doing really well. Yeah.
So that's important. And also, I will say the notifications and stuff that Cinema Veterinary Center does, I mean, not only with the follow-up emails, but also even the phone call and reminding us that there's, coming up with the pet appointments and things like that, I think is terrific because I haven't, in all the years I've been here, not that quite that level of follow-up, and I think it's terrific. Thank you so much.
Thank you so much.
Cinemavet.com. I can personally attest to the quality of service of Dr. Ronchetto, and located, of course, on Cinema Drive. The phone number is
661-253-9300.
Always informative. Thank you so much, Doctor.
Thank you.
7:46, traffic after this.